Here's something to watch out for in terms of thinking about, could it be an infection? Think about, did you in general have pretty good health and things were going along okay, and then really all of a sudden there was a drop off in your energy. You didn't feel like yourself and you just never really recovered from that. If that sounds familiar, then that's likely to be an infection, and yet these things just aren't really screened for.
You are not defined by a normal blood test. If you don't feel well, you need just more testing.
But if you notice pain that moves from joint to joint, from place to place, that is almost always an infectious disease.
The better detoxifier you are, the more resilient you become. When you become resilient, the body can handle this mechanism. But I can assure you, if you end up doing very, very little and you just rely on medication, you're probably going to fall short. You have to catch this infection early, and sometimes you don't. But it still boils down to your immune system.
Absolutely.
Okay? Give me some of the go-to supplements that has scientific research to help with not only infections, but boost the immune system. Welcome to Rethink My Health Radio Show. This is Dr. Gez Agolli here, going to be your host, and we come to you every week from our studios in Atlanta, Georgia, talking about healthcare matters that matter most to you, your family, your loved ones, and as I say time and time again, they do matter to most to the scientists, the research practitioners, the doctors in the trenches, day in, day out, working on getting to the root causes of chronic disease. Chronic disease is long-standing. Unlike acute disease, we're looking for chronic factors that are contributing to your health. Today's topic is a very interesting topic, and we're going to be looking at root causes of something that we call co-infections. And if you've heard me in the past on Rethink My Health Radio Show, we talked about some of the common denominators of chronic diseases. And one of that is infections that could cause inflammation, and it could affect your immune system. I call it the 3 I's of chronic disease. And one of the reasons why I want to talk about that is during these holiday seasons, a lot of times our diet goes to the wayside. Our sleep habits are not optimal. There's a lot of different activities and festivities that we all enjoy with our families, friends, and loved ones. But sometimes we don't pay attention to our health. We overeat sometimes, maybe not sometimes, most of the time. And we also make poor choices. So what do? We start January, which is right around the corner, with this something called New Year's resolution. And we'll probably devote a show to that in the next couple of shows, the positive and the negative about that. But the bottom line is that we don't pay attention to our current health. So join with me in the studio today is Dr. Cheryl Burdette. She is the educational director at Progressive Medical. She's also one of the co-founders of Precision Point Labs, and she's a lecturer, educator across the world. Dr. Burdette, first of all, welcome to the show. And I know that you and I have been talking about a series on chronic health issues here on Rethink My Health Radio Show. But let's just jump right into this. And the very first question I want to bring to you is Dr. Richard Horowitz, who's a colleague of yours. He's devoted most of his medical career to co-infections and something called MSIS, multiple systemic infectious disease syndrome. Let's talk about why should we even bring this awareness to the public about these infections? Doesn't a regular internist or family practitioner focus on this?
No, and one would think that it would be something that would be very obvious and common blood work. Surely there must be a way that it comes up, but it doesn't. It's not one of the things that's routinely screened for. Yes, there are some standard lab markers like a white blood cell count, but that doesn't capture every single infection out there in any way, shape, or form. And so many people are left with and here's something to watch out for in terms of thinking about, could it be an infection? Think about, did you in general have pretty good health and things were going along okay. And then really all of a sudden there was a drop off in your energy. All of a sudden you didn't feel like yourself and you just never really recovered from that. If that sounds familiar, then that's likely to be an infection, and there's likely to be things that you can do to clear that infection, meaning it's not a genetic disorder, it's not something you're stuck in place with, it's not a permanent diagnosis, and yet these things just aren't really screened for.
They're not screened for, and I agree with you. And, once again, these family practitioners are very, very busy. And here's a message we have for listeners out there. If you've experiencing all kinds of different symptoms and you're just not feeling right, this crushing fatigue, you got migratory pain is one of the key symptoms that we've seen out there as well. Basically feeling inflamed and really always feeling like you're having the flu all the time is one of the issues. And unfortunately, there are a lot of practitioners that don't even consider Lyme disease, depending on the area, as one of the issues because you'd have a bullseye rash. You don't have to have a bullseye rash. There could be something else, and there could be co-infections. So Dr. Horowitz developed this questionnaire. I'm not sure how much you know about the questionnaire. I know that we offered at Progressive Medical. It is available online. I think this questionnaire, pretty much when a patient fills it out and they hit over a 70%, it's like a 95% accuracy.
Absolutely. Yeah, so if you're sitting out there and you have noticed a drop-off in energy and you just don't feel like yourself, then think about pulling up the Horowitz questionnaire, filling it out, and if your score is high, reach out to us at Progressive because there's a lot that you can do to recover those energy levels. So again, when we show up in a standard of care practice, what we see is that they do look at things like a white blood cell count, which is how your immune system's reacting. Or maybe, of course, they look at things like body temperature to determine if we have a fever. But all of those tell us more about an acute infection, and none of those really tell us about a chronic infection where we're not really mounting a high fever or our white blood cell count doesn't go up like normal and our immune system isn't responding. And this is why we end up with a chronic infection. The blood tests that are routinely run assume that your immune system is going to act normally, which is to increase in response to infection. But the exact people that get a chronic infection, it's because their immune system can't respond like it should. So the tests miss people that are struggling with these issues that are very fixable.
And that's one of the things we're going to get into at Rethink My Health radio show today is we're not only going to educate you on these infections and co-infections, we're going to talk a little later on about some of the treatment options that are not conventional, that are not standard of care, and something that's so unique if you have these co-infections. And we'll also talk about the testing in a second. But I want to stick on this questionnaire with Dr. Horowitz. And for those of you listening for the first time, this is Rethink My Health radio show sponsored by Progressive Medical Center. If you feel that you may have these co-infections and you've been to numerous doctors, even an infectious disease doctor possibly have missed this, and they don't run some of the specialty testing we talk about, just shoot us an email at info@progressivemedicalcenter.com or GEZ22@progressivemedicalcenter.com. That's GEZ22 at Progressive Medical Center, and just say questionnaire, and someone's going to shoot you the questionnaire, and then you can take a look at it. Or you can go online, Dr. Horowitz, MSIDS, it's called questionnaire. So getting back into these symptoms and the testing, let's just get into the testing for a second. Okay, so a patient comes into a doctor's office that practices functional integrative medicine, and practicing integrative medicine is just using a combination of both East and West, allopathic and holistic, natural, looking at root causes. What type of blood testing would you order, Dr. Burdette, on a patient that had a positive on the questionnaire? What would you do?
Yeah, so we'd be taking that history, we'd be looking for people that just didn't feel like themselves anymore. And so again, often we think of like, if I have an infection, I'm going to have a headache or a fever or stuffy nose. Well, you can have infections, for example, in your gut, in your GI tract. And you're not going to have a stuffy nose, you're not going to have a headache, but you're going to feel run down kind of every single day with that lower energy as if you had a cold. So if you're really noticing lower energy, or I want to hit on one other point that you mentioned, if you have pain that moves from place to place in your body, 90% of conditions do not do that. If you have an old football injury, soccer injury, gymnastics injury, that's in that same knee, that same place in your back. If you have rheumatoid arthritis, that might intensify throughout times of the day, but it stays in the same joints where it shows up. But if you notice pain that moves from joint to joint, from place to place, that is almost always an infectious disease. So definitely think about getting in touch with us if that's a presentation that you notice.
Migratory pain's a big one. We see that quite a bit, and it's very frustrating because they're in pain, but it's just shifting all over the place. So that's a good point.
Yeah, and so that's a real hallmark. So then from there, now that we've gotten those key bits of the history, we know to do a deeper dive into what infectious disease are out there. And so really starting with something that looks at a broad array, looking at not only, for example, Lyme disease, but you already mentioned some of those co-infections that go with it, and various viral conditions as well. Things like Epstein-Barr virus we know can lay dormant, but then get reactivated in the body, and you begin to have fatigue and just not feel like yourself. But again, it's not genetics. It's not that you're getting older. It's an infection that we can clear. So in a lot of ways, it's positive.
Deeper dive, Dr. Burdette's mentioning here. So do the blood work. We look at these different viruses. And since you mentioned Epstein-Barr, Epstein-Barr is a virus that's pretty common. You're probably looking at world population between 65 and even 75% have been exposed to that. So sometimes you're going to go to the doctor and say, oh, that's an old virus. And they look at something called IgG, which is delayed, but it could be in convalescent. But the problem is some of these titers are so high, and that if your immune system is low, this virus can come back up, because really it's about your immune system. So it's not only addressing the infection, you have to address the immune system. So we do a very thorough analysis on immune function as well, which 65 to 75%, sometimes even 80% scientists are reporting that your immune system is in the gut lining. So when it comes to these viruses, Dr. Burdette, I want to talk a little bit about Epstein and cytomegalovirus. And there's other ones out there as well. But a lot of times individuals that come in with cancer, and they come in, well, how did this happen to me? And, sometimes a lot of people think it's genetics. Now we're finding out it's less than 10% genetic, but it's also the expression of the gene. But there is correlation right now that Epstein-Barr may contribute to cancer.
Absolutely. And that makes sense, because when your immune system is constantly fighting an infection, it means it's busy. And so it can't do the immune surveillance we need to do to weed out cancer cells that crop up. So, of course, there's a connection between infections and different cancers out there. And we see that across the board from things like Epstein-Barr virus, or various viral hepatitis that can evolve into cancer, or viruses in the cervix that can evolve into cervical cancer. So we know this relationship between infections and various cancers. And again, these are things that can cause an increased risk of cancer, but also autoimmunity, more fatigue. And again, they're very treatable. So Epstein-Barr virus, we saw it rear its head recently because there was a lot of reactivation when people had COVID. So if you are thinking, my energy just hasn't been great over the past few years, 4 or 5, I want you to think back, and I want you to think if maybe you had something that presented like a cold or flu, COVID, and then after that, your energy was never quite the same. If so, you may have a reactivation of Epstein-Barr virus. And again, good research with things like IV vitamin C, using high-dose vitamin C IV, doing other oxidative therapies. All of these things can eradicate the virus, restore energy, and restore immune function.
Since you're talking about these viruses, we've seen big problems with Epstein-Barr, cytomegalovirus as well. Also, when it comes to COVID, and I know that talking about COVID is even feeling foreign right now because it happened it's actually 6 years.
Wow.
It's coming up to 6 years where it began, so it just completely disrupted the whole world. But now there's research coming out of South Korea that COVID itself can inactivate the P53 gene, which is the anti-tumor gene. And what's really interesting is that I didn't really realize this till I heard a physician talk about this, that elephants have 8 P53 genes, and they don't get cancer.
Wow.
So I'm not asking you guys to be an elephant. But anyway, that's basically what happens is it inactivates. And what's interesting about these viruses, when it comes to HIV, for example, as a virus, and that devastated in the late 80s and 90s, and they researched how can we help these patients that contract HIV. And what was interesting after they did the research is that one of the reasons why the HIV virus became so prevalent and actually in the scientific world popular is because it inactivated CD4. Mm-hmm. And CD4 is needed for CD8 to make cytotoxic killer cells, natural killer cells. So T cells are very important.
Absolutely.
And that's why that virus inactivated. So looking at the research right now with COVID, the P53. So now we're starting to understand why we're seeing more and more aggressive cancers these last few years. So there's certain strategies for P53. How to increase that, proper rest. We've seen studies with green tea, curcuminoids as well, resveratrol. So there's a lot of positive things you can do to increase your P53 gene. But that's interesting with viruses. So getting back to what our discussion is about today on Rethink My Health Radio Show is that we want to educate the listeners. This show is about education. This is not here to replace your medical doctor's advice. It's for you to be educated and to be armed and ready when you talk to your doctor during your next office visit. And listen, if you're not getting the answers, you need to find a new practitioner that's going to do a deeper dive if you're not getting answers. And that's what our philosophy is, do deep dive. Mm-hmm. And that's why we believe that integrative medicine is just good medicine. Okay, so getting back to the questionnaire. Mm-hmm. So you got the questionnaire. You do some blood work with these co-infections. Any other testing that you would do for some of these patients? Definitely run the full panel on the blood work and the virus, and also a stool. Anything else that you're looking at?
Yeah, and you just mentioned it. A stool test is absolutely a go-to because a stool test is going to give us information about 85% of your immune function. And so this is one of the beauties of being in the integrative space of treating infection is that I think that largely, even if we're using some similar treatments, we tend to have better outcomes because we're not just treating a bug, we're thinking about how to augment immune function as well. So that stool test shows us 80 to 85% of somebody's immune function, and that allows us to continue to fine-tune the immune system. And so this is the beautiful one, too. Treat the bug, kill the bug, but also build the person. And that's the part that can be missing. And when you do those two together, faster outcomes, better results, and less risk of recurrence.
Absolutely. Makes perfect sense. That's why at Progressive Medical, when we're looking at root causes, we're looking at something called the 3 I's of medicine, and that's looking for an infection, finding out what's happening and causing inflammation. It could be the infection, but it could be other things too with inflammation. And the other I is the immune function. So you can treat the infection, which is very important, by the way. We're not against antibiotics. We're not against antimicrobials. Mm-hmm. We just use a combination. An integrative practitioner is going to use a combination of certain medications after we culture that infection, right? So we know what actually medication is going to work. Mm-hmm. And then you can use certain botanicals that we know have been studied, have been researched, and now we're going to build the immune system up. And this is very important. And it's lifestyle. Lifestyle medicine is probably one of the most important things. On our last previous show, we had Dr. Pete Sulak, who beat the odds had like a 1% chance of survival. And his doctors, very reputable places, MD Anderson and Duke University, and you know, they were basically telling him statistics. But Dr. Pete decided to think outside the box, and he's still alive today, cancer-free, but he worked on his immune system, right?
Absolutely.
He worked on these potential infections. He ran a whole profile. We found lots of infections. He worked on that. And, you know, a lot of doctors just treat the infection, which is important. Don't get me wrong, right? Not here to disrespect those doctors, but they're not focusing on the immune system. And what Dr. Pete said was powerful. Regardless of what you choose, whether it's just straight allopathic medicine with medication, it's really adding these lifestyle modifications. Mm-hmm. Proper sleep. I'm going to call this vitamin S. That's right. You heard it here for the first time on Rethink My Health Radio Show. Vitamin S, sleep, is probably the most important things. Dr. Mercola actually wrote one of the chapters in his book talking about, and I remember having dinner with him at a conference, and he was doing all this research. And I asked him one question. I said, "Hey, Dr. Mercola, what's the most important thing?" And he basically said, and this guy's been published all over and really just done a lot of great things for our society when it comes to nutrition and wellness and health, is that basically he said that sleeping is the most important thing. And without proper rest, the body's not going to restore and rejuvenate. And that's where the immune system recovers.
Absolutely. But yet then people can have difficulty sleeping, and they can even have difficulty sleeping because of infections. It turns out when we have a chronic infection, it makes these inflammatory cytokines, and those can actually compete with melatonin, the hormone that should be going up at night to help us to sleep. So even disruptions of sleep can boil down to infections in our body that start to crank these inflammatory mediators. So just take inventory. Are you waking up at night? If you wake up at night, do you ever wake up feeling warm? So for many women that will just assume, especially women that are 50 or older, they assume maybe they're having a hot flash. Not always. That can be a sign of a chronic infection as well. So take that into consideration. Do you have lymph nodes throughout your body that will just swell and remit for no known reason? That's another sign or symptom of a chronic infection as well. And of course, is your energy low? Are you having that fatigue level?
Very, very, very important. So, hey, this is Rethink My Health Radio Show. We're talking about infections, co-infections, viruses, Lyme disease. All of these things could possibly rob your life. It's so important to take action. You know, at Progressive Medical, we do a lot of research, and we have been looking for all kinds of diagnostic testing that will really help our patients, and we're constantly learning. And I'll have to say that strategy of looking for the infection, finding out what's causing inflammation, and focus on the immune system, that's one of the key components. A lot of patients out there going through really difficult times with treatment with cancer and autoimmune disease. And autoimmune disease is a little different. We can talk about that in another show. That's a different animal, but there are some common denominators there that are from infections as well. But I think it's important for our listeners to understand that there is hope out there. Do the questionnaire if you're experiencing some of these symptoms. Find out, and then you find a practitioner. It doesn't matter where you're listening to us, whether it's here in the United States or internationally. If you shoot us an email, we'll help you find a practitioner near you, or we even have some practitioners that can do telemedicine visits across state lines that have licenses in those states, that we can talk about that as well. But I Rethink My Health, our goal here is to educate you to take action for your health. There are things that you can do for yourself. Sleep hygiene, I call that vitamin S, right? Very, very important. Lifestyle modifications, as Dr. Pete talked about, when patients even do just traditional medicine, just adding that lifestyle is going to improve their outcome. You can control your tempo. You can control what's going on. I know it's this time of the year. A lot of individuals possibly listening to us saying, well, wait a minute, let me just get through Christmas and let me get through New Year, and I'll start my New Year's resolution. Well, typically that New Year's resolution doesn't last very long. So, but that's okay. You can set some goals. I think setting goals are very, very, very important. And now keeping the goals, one of the key denominators is that anything that's habit forming takes 90 days to become a habit. So we truly believe that you need an advocate, you need a coach. So at Progressive Medical, we just started working with health coaches, which I'm really excited, by the way. We're hiring a couple more health coaches to assist you on your journey. Doctors and nurse practitioners, naturopathic doctors are very good at diagnosing and set up treatment protocols, but you need support. You need that accountability. And this is a journey, and that journey starts with that first step, Dr. Burdette. Mm-hmm. Hey, this is Dr. Gez Agolli here, Rethink My Health Radio Show, coming to you from our studios in Atlanta, Georgia. Exciting topic. We're talking about the 3 I's right now. When we get back after the break in a couple minutes, we're going to dive in to some very, very innovative treatments, some that you probably never heard about. So stay tuned after that. Dr. Burdette, also, before we got on the break, we got a couple minutes. You were talking about some of the testing, and we talked about the stool test. We got the blood test. What about the secretory IgA? I know it's a saliva test. How does that play a role in looking at immune function?
Yeah, so that is that parameter that will show us 80% of our own immune function. And so as you move into it, we want to know where's your immune system at, because we don't want to use different antimicrobials, kill off a bug, but not build the person, because that can result in things just coming back over time. Another big important thrust of what we do is to use natural therapies. A nice part about that is with conventional, for example, antibiotics, as you kill off bacteria, other bugs can grow, like yeast. You can exchange one infection for another. And when your immune system is down, that's not so great. So we want to make sure that immune system is built up, and we use therapies that don't just trade one infection for another. That's really a big benefit of integrative therapies. Build the person and make sure we're not just swapping infections out.
You heard it from Dr. Burdette, one of the experts in natural medicine. You build the person up. You can take advantage of this knowledge. It's taken one step at a time and being consistent. It's more than just taking supplements. I want to talk about supplements as well. It's lifestyle. It's getting yourself tested. If you don't test, you just guess. Find out what's going on. How do you know if you have a low immune function? You got to test, and that's why I mentioned the saliva test, secretory IgA, right? That's part of the mucosal lining of your gut. That'll tell us one component of the immune system. There's some other blood tests as well that other labs are developing as well. Hey, stay tuned back after the break. This is Dr. Gez Agolli here on Rethink My Health Radio Show, where we come to you each week talking about innovative topics that really help you take control of your health and hopefully galvanize you to take action. We'll be back in a moment after this break. And we're back. Welcome to Rethink My Health Radio Show. What a great topic, Dr. Burdette. And I'm not saying it's a great topic because patients are sick. What's a great topic is that we're bringing an awareness that there's hope. A lot of times it's so frustrating for patients to go to doctor, and run this test and run that test, and they say it's either normal or it's low normal or you're within that parameter. You are not defined by a normal blood test. If you don't feel well, you need just more testing, okay? Some of the tests that doctors run, CBC and CMP, are very, very important. But sometimes when it's normal, it doesn't mean you're healthy, okay? Because there's other testing you have to look for. And that's why we're going to encourage you, as we said at the beginning of the show, research Dr. Richard Horowitz. He is a published author, New York best-selling list, and he talks about this, some of the frustrations with co-infections and Lyme disease. And if you need a questionnaire, we'll just shoot us an email. I gave you our email earlier. You can just send an email to gez22@progressivemedicalcenter.com and just put on the title questionnaire, MSIDS questionnaire. It's MSIDS, MSIDS. That's gez22@progressivemedicalcenter.com. Okay. So let's get right into now, Dr. Burdette, some of the treatment options. Okay, so a patient comes in, they do a questionnaire, they see a functional practitioner, they come back, and let's just say they've got a co-infection. They got Babesia or Bartonella, and they got a virus. And okay, let's just get right into the treatment right now. So what can a patient expect for a treatment protocol for a pretty aggressive, someone that's been suffering for a while? What would you recommend?
Yes, so we've really built Progressive to be the model for where you would want to go to treat infections of this style. And so, again, we mentioned how it can be a risk factor for cancers, and I talked a lot about fatigue and energy, but I also just wanted to mention that if you have the diagnosis of an autoimmune condition, often the root cause can be an infection. That infection, your body made antibodies to the infection, those cross-react and attack your own tissue, and it's a reason for the autoimmunity. So if you're fatigued or have pain that moves from place to place or have an autoimmune condition, all of these things, the headaches, all of this, the root cause could be an infection that can be cleared rather than, something that we see as more permanent, like a diagnosis of rheumatoid arthritis or, ALS or various autoimmune conditions that are out there. So then from there, we want to get right into treatment. And so when we think about treatment, what we know is that there are certain nutritional IVs that can be really important. And there are ways to even make those nutritional IVs work better. So if you come to Progressive, you can expect a very full kind of treatment protocol around this. But again, it's not something you're doing for forever. You're doing it for a period of time to kill the infection. And when the infection is done, so is that diagnosis. So we'll often work with things like oxidative therapies that can be done via IV. An exciting one that we're a clinical research center for, something called EBU. And so that's really our fingers on the pulse with it, gathering data, helping to move this field forward. But even therapies like that are fairly exclusive to Progressive, except for a handful of international centers right now, even with that, we're going to combine it with hyperbaric oxygen or with infrared sauna. Because, for example, if first we put you in the oxygen chamber and then heat the system, that kills bugs that are deep in the tissue space because oxygen can penetrate that tissue space. But in addition to that, if you sit in the infrared sauna first, that will force, for example, Lyme disease out of the tissue, where now the nutritional IV can kill it at a faster rate. So it's not just one therapy, it's these puzzle pieces and how we put them together, not only the various therapies, but how they match the condition that you have.
Yeah, very, very important, because heat is so important. Infrared is a very specific wavelength. It mimics the sun's radiant heat. It's very, very specific how it penetrates into the skin. A traditional sauna does something a little different. It heats the air. This coil, especially near infrared and far infrared together, goes in deep into the dermis, which is the middle layer skin. So that's really important. And that's a great point, Dr. Burdette. Also, I want to mention, in addition to what you're talking about, you mentioned something called EBU, extracorporeal, that's blood outside, right? Extracorporeal blood ozone oxygen is what the acronym stands for. And we've been part of a research study with equipment from Stratos talking about oxidative stress and how that affects the body. And this is where we're inducing oxidative stress, because the human body has its own mechanism to make oxidative stress for pathogens. Too much can cause other damage at the cellular level. So it's kind of a balancing act as well. And this is a lot of ozone and oxygen going through the entire system. But before that, one of the innovative treatments that one of our practitioners brought to us over the years, it's called ultraviolet beam, basically UBIs. And this is going to clean the blood out, right? Go through this photoluminescent light, and it's circulating the bloodstream, and it's killing off any potential pathogen, inactivating viruses as well. And then also that light, the photodynamic light, is also regenerating, and it's helping activate certain cytokines, which are messengers of the body, and helping the immune function as well. So it's very interesting. There are options for these infections. And you mentioned something that I think is powerful. Multiple therapies. We call them stacking therapies. Yeah. A lot of other facilities just do the IV. Okay, go home. Okay, that's fine, but they're not stacking. They're not looking at other therapies as well. We have noticed with chronically ill patients that their lymphatic system is not functioning properly. So we have different strategies for the lymphatic system, something called LymphStar. You can even just use a rebounder. Very important. Also, we've seen that oxygen, besides the hyperbaric, we just started something called EWATS, which is exercise with oxygen. So these are all the great strategies to rebuild up the body. Here's the most important thing, is to get tested and then find out the treatment plan, okay? I think it's more than just taking a medication. It's more than just taking a supplement. It's looking at this whole holistic plan, because when you're sick, right, you've got to focus your entire energy to getting better. You're not just going to get better on your own, especially when it comes to an infection. And one of the problems with, especially with these co-infections, as we're talking about the treatment, Dr. Burdette, we forgot to mention about biofilms. Can you educate the listeners what exactly is a biofilm? And This could explain also why just taking antibiotics don't work on its own.
Yeah, so this is a very important part that needs to be addressed as well. And it can sound very science fiction, a biofilm, hardly even sounds like something that's real, but it absolutely is. And a biofilm is something that a predator, in this case, the bug that's attacking your immune system, the bacteria, for example, it creates this protective layer, and that is the biofilm, that it surrounds itself in that, and that makes it very hard for therapies like an antibiotic to penetrate. So it does this as a protective wall. And so maybe you were diagnosed with Lyme disease in the past, and you went on some antibiotics and you felt better, but then after a period of time, you notice that fatigue came back again. It may very well be that you cleared part of the infection, but not all of it, because that biofilm was there protecting the bug from the antibiotic. So at Progressive, we use different therapies that will also help to address the biofilm, so that when we do now add the nutritional IV or oral antimicrobials, they're going to get right into that space where we need them to be provided. So we can use different agents, things called, for example, EDTA, or different enzymes, or sometimes we'll use our compounding pharmacists to put together biofilm formulas that can be helpful in terms of making sure we don't just throw the same thing at an infection. Well, it worked a little bit before, but why didn't it work completely? And so again, we'll take the history, we'll think about this. What are the obstacles? Was there biofilm? Is there resistance? Did we not build your immune system enough? And when we do all of those things together, this really gives us a much more complete response.
It's a great strategy. And this is why we're seeing antibiotic resistance in our country right now, because the advent of antibiotics is definitely a wonder drug at that particular time, but we've been overusing them. It's in our food supply. It's been prescribed. It's in our water system, believe it or not. So believe it or not, unless you're having filtered water, you're probably drinking a bunch of drugs. Mm-hmm. And that's just shown right there, because the half-life of drugs is not long, and you're going to urinate them out. They got to go somewhere. So it's also very important to look at clean water, which is a very important component when you're looking at your whole lifestyle modification. But these biofilms basically are going to affect your body's ability to destroy that bug, and you got to break them up. And there's different strategies, and one of those strategies is photodynamic. And photodynamic is a very specific light band that we can do intravenously. We do have the machine, the equipment from Germany, from Dr. Michael Weber developed this. Great strategy. You do the photodynamic first, and then you can have the medicine afterwards. So there's a lot of strategy here. Heat therapy, oxygen therapy, light therapy. These are the strategies. Listen, if you're sick, okay, and you've been struggling for all these years, I implore you to think outside the box. Find a functional practitioner that has these tools if you don't live in Georgia, or you can come into Atlanta to visit Progressive Medical Center, or find another integrative doctor that has these therapies. Ask them questions. It's more than just taking the medicine. It's more than just taking the supplements. When you're chronically ill, you have to have certain strategies. And that's what we put together, is that we have a strategy session. It takes time. Nothing happens overnight. Mm-hmm. So I want to get right into this expectation, especially when it comes to Lyme disease. That definitely takes a toll on the human body. But give us an example. Let's be realistic right now. Someone's been suffering for years. How long does it take for this patient to get better?
Okay, so if you have been suffering for years, a rule of thumb is a month of treatment for every year you have been ill. Now, there's no absolute to that, and everybody's different. And the more we can help you dig into the diet and lifestyle components, the faster we can track this thing in terms of getting well. So that folds into it as well. But in general, again, this is an infection. It's not a genetic condition. It's not something that you have to treat forever and ever and ever. And so we can expect to see things get better. And again, I want to make that point that if you are diagnosed with an autoimmune condition, or you feel like every little thing gets you more run down, then you may well have a chronic infection that can be cleared, and then you feel better. You're not catching things all the time. And rather than have a permanent autoimmune diagnosis, we can talk about permanent remission instead.
Yeah, and that is a good rule of thumb. I'm going to say that probably when it comes to Lyme disease is probably 2 to 3 months per year, maybe even longer, because it's very, very difficult. Sometimes these infections and these biofilms are very, very stubborn. The more aggressive you can be and the better detoxifier you are, and I'll tell you what that is in a second, right? Your body has its own innate ability to detoxify. You have to help the body detoxify. And there's certain strategies. Infrared is one of the best strategies, but also your lymphatic system. There's some German homeopathic spagyric remedies that also assist with that. So the better detoxifier you are, the more resilient you become. And that's really the key. When you become resilient, the body can handle this mechanism. But I can assure you, if you end up doing very, very little and you just rely on medication, you're probably going to fall short, okay? Unless you catch it early.
Absolutely.
Okay? You have to catch this infection early, and sometimes you don't, okay? But it still boils down to your immune system. We talked about that, the 3 I's. Let me go back one more time. I, number 1, infection. Test for it, look for it, treat it. I, number 2, inflammation. Find out what's causing it. Could be the infection, of course, but it could be a food sensitivity. It could be an environmental toxicant. It could be a heavy metal. That could be causing inflammation as well. It could be nutritional deficiency, okay? You could be lacking antioxidants. You could have oxidative stress. I, number 3, which we feel is going to set you up to handle the infections, is your immune system. You have 2 immune systems, one inside the cell, one outside the cell that has a memory, your humoral. So we have to work on this. We have to work on this strategy. It's a strategy to build your immune system. Okay, Dr. Burdette. We've talked a lot about on this show. We've talked about some innovative treatments. We've talked about EBU. We've talked about ozone, ultraviolet, photodynamic, different strategies with oxygen. We also have something called an ozone sauna. These are all fantastic, okay? Let's now get into some nutritional therapies. Educate our listeners. Give me some of the go-tos, some of the go-to supplements that you've seen in the past that has scientific research to help with not only infections but boost the immune system. Give me your top 3. Let's make it simple.
Yeah. So, I mean, right off the bat, I'm going to say vitamin D. And here we are. We're in the midst of cold and flu season. We know that viruses are at an all-time high. Probably, if you think about it, most people that you know right now have been sick or have a little lingering cough, something like that. Have you looked at your level of vitamin D as you're headed into cold and flu season? And if you haven't, you should, because getting your vitamin D to at least mid-range, and see, so it's not always the dose that you take, but your own personal level. And so we need to see that vitamin D get mid-level or even to the upper end of normal range to have you most protected from different infections out there. So we all know vitamin D is important, but how do you know if you're getting the right dose for yourself? A second one that I like is, of course, vitamin C. And in fact, that's one of our go-tos and a good heavy hitter for Lyme disease, but even things lesser than that. I bet we all reach for some vitamin C if we have a cold or a flu. We know that. But in terms of Lyme disease, you really need to get to gram amounts of vitamin C, not milligrams, but grams. And so we'll do that through an IV delivery system. And this is how you really load the immune system to get to those levels that are going to allow it to pop and really flourish and kill things off, but yet keep you healthy. See, this is the difference. So if we use an antibiotic, it kills bacteria, it can kill Lyme, but it's also very hard on you because the way it works is by targeting the mitochondria so that the bacteria doesn't have the energy to divide. Well, unfortunately, that cross-reacts with our own mitochondria where we make energy as well. And so many of those drugs can be toxic to our body, toxic to the very part that's making energy, when one of the biggest complaints with the infection is the energy that it causes to drop off in the first place. If I contrast that with vitamin C and a high dose through IV, that's not only going to kill the bug, but it increases my immune system. It helps my adrenals that make adrenaline, my get up and go hormones, and it protects my mitochondria because it functions in a way that increases glutathione and other antioxidants. So while all of us know vitamin C, the ability to deliver it in high doses in an IV are really unique. I'll slide in with a third one, an herb that we have at NutriCare at Progressive, something called Viragraphis, and it's a combination of indigo, but also andrographis. And that botanical is such an effective antiviral that as soon as COVID broke in Wuhan, they began to give patients in the hospital andrographis. And those that got it were less likely to go to intensive care. They knew it was such a strong antiviral. We didn't know much about COVID, but we know this is antiviral. So they brought that in. It's a botanical that we've used for decades at Progressive.
Yeah, it's a broad spectrum antiviral.
So that's a great one.
That's a great one. I totally agree with those. I'm also going to add, since I only told you to do 3, I'm going to give zinc. Yeah. I always tell people, think zinc. Which is very important. Because why is zinc so important? Because it's a cofactor. All minerals are cofactors. But without zinc, your immune system does not function properly. Also, it helps with hormone balancing, especially for men, for testosterone. And also, you become resilient as well. You don't have to go high doses, probably 40 to 50 microgram, that's a good dose. You don't want to go higher than 100 because it can affect your copper as well. But, once again, these are all great strategies. I totally agree with you. When it comes to vitamin C, very, very important. If you're listening to us on Rethink My Health radio show, if you go to one of these hydration stations, if it's convenient, make sure that you ask them to give you non-corn derived, because a lot of these places are using corn-derived, which most corn in our country is GMO. You don't want that. We use high-dose vitamin C from cassava root. We're talking 50 to 75 grams. It's very, very important that before you do this IV that you have something called a G6PD test. That's a very specific enzyme. If it's too low, you cannot go that high. It could affect your red blood cells. So make sure you go to a qualified practitioner that knows how to administer high-dose vitamin C. Great strategies, Dr. Burdette. So now, looking at the entire picture right now, the advice that we're giving our listeners right now to go to their practitioner, ask them questions, get the Dr. Horowitz questionnaire, think outside the box. It's a very good strategy. Is there anything else? I know I only wanted you to limit to 3, but let's go a little further right now with the supplements. Any other supplements that you've researched? Let's stick on Lyme disease for right now, because that's a very, very challenging and difficult one, and patients are taking so many different supplements. What other supplements out there, putting all the medications and IV that you've seen and researched that are going to help with some of these co-infections?
So there's a whole host of botanicals that can get used for Lyme disease. And the nice thing about this is, like I said, they're much less toxic to the body than conventional antibiotics. They spare our microbiome and they don't hurt our cells. They don't hurt the mitochondria. And so in Lyme disease, you often need something that can kill a bug more long term. So it just makes sense to lean on botanicals. They're as effective at killing things, but not as hard on our system. So when I think about that category, there's one botanical that I'll often combine, something called Cryptolepis, and so that one we can get it even from some of our compounding pharmacies. It's still just a botanical, but to get it in that nice high dose strength, we've got to lean on some of our partners in order to do that. We'll often combine that with things like cat's claw or atobo root or Japanese knotweed. And so as you go through some of the botanicals out there, you'll quickly see, there are 10, 15, 20 different botanicals that are routinely used. And so when you sit down with a practitioner at Progressive, we're going to think about the fingerprint or the energetics of these botanicals, and from there be able to decide which ones are most appropriate for you, and then a rotation schedule. So we're constantly hitting the immune system with something different, keeping it guessing, which is an effective way to get your body and to the finish line in terms of eradicating that infection.
I think the rotation is critically important. Thanks for that advice. I totally agree with you. Japanese knotweed's fantastic. Artemisinin also is another one that we actually offer artemisinin in IV form. So you could use it from a botanical, but it's important to understand that this has to be dosaged properly.
Absolutely.
Especially when you're using these IV therapies. These are great strategies. I do want to mention as well, there's been a lot of research when it comes to viruses for a product called monolaurin made from lauricidin.
Yes.
And that's an antiviral. Lots of research on that. So that's also available over the counter. Once again, I implore all of you that are listening to Rethink My Health, this is not here to replace your your medical doctor's advice. This is not medical advice. This is really galvanize you to take action for your educational purposes. Ask these questions. Ask your practitioner to think outside the box. If you're not getting the answers, look elsewhere. Get the questionnaire done. This has been a great show talking about the 3 I's, Dr. Burdette. We're almost at the tail end. Any last words of wisdom for our listeners to take action?
Don't just accept that a diagnosis you've been given and that there's nothing you can do about it. So in that example of an autoimmune condition, many times what happens is you get put on something anti-inflammatory or immune suppressive, yet the root cause was an infection. So now you suppress the immune system, the infection grows, you need more anti-inflammatory over time, it escalates. We can turn that around by treating the root cause, which is an infection. As you treat that, you don't have as much inflammation, you don't need the immune suppressive drugs anymore, and we can get you back to that state of health.
Absolutely. We call that homeostasis, where everything's in balance internally, regardless of external factors. Hey, Dr. Burdette, thank you so much for sharing your wisdom. This is exciting. Hey, if you like Rethink My Health radio show, ask your friends and your family to listen. We're going to continue on our journey. This is a journey about wellness. This is a journey about education. This is a journey to help you galvanize to make 2026 your best year for your health. If you've been suffering from chronic debilitating diseases, take action right now. Get up, start doing something about it, get tested. When you don't test, you just guess, and you can see your health improving one step at a time. And at Progressive, we have a whole team to help you. This show is sponsored by Progressive Medical Center. Thank you for them for sponsoring this show. And we want to thank the station as well for having us. Hey, this is Dr. Gez Agolli. My pleasure being here educating you. God bless all of you. Be safe this holiday. Merry Christmas and Happy New Year to everybody. And remember, a cheerful heart is good medicine, but a crushed spirit dries the bone. That's Proverbs 17:22. Do not be crushed. God bless you guys, and we're going to see you next week here on Rethink My Health Radio Show.